Hi, I'm Dr. Tan Cheng. I'm the obstetrician and gynecologist in Dongxing Hospital.
Caesarean section is an operation. It involves a cut at the lower part of the tummy to enter the womb, the uterus, in order to deliver the baby. Caesarean section can be done as elective, planned, or emergency, unplanned. Emergency caesarean section may be performed in the cases of umbilical cord prolapse, which is when the umbilical cord has come out before the baby is delivered. Fetal distress, which means the baby's well-being is compromised. This can be detected by the baby's heartbeat patterns during monitoring. Placenta abruption, which means the placenta has separated before the baby is delivered. Severe preeclampsia, which is a condition associated with uncontrolled high blood pressure and the presence of protein in the urine during pregnancy. There are other causes that may require emergency caesarean sections. Your obstetrician may plan a caesarean section for you if there is cephalopelvic disproportion, CPD, which means there is a size mismatch between the pelvis and the baby. Placenta previa, which means the placenta is the one presenting before the baby. Malpresentation, which means the baby is not in the head down position. It can either be bridge presentation or transverse presentation. Multiple gestation, which means there's more than one baby. If it's a twin pregnancy and the first baby is not in the head down position, caesarean section is advised. Macrosomia, which means the baby is too big that the doctor thinks that it might be riskier if to continue with vaginal delivery. Caesarean section also can be carried out for maternal request after discussing the risks associated with caesarean section. It normally takes about 30 minutes to an hour for a caesarean section. However, you may need to be in the operating theatre earlier before the operation. You will also spend some time in the recovery area before being transferred back to the ward. Most caesarean section is carried out under spinal anesthesia, which means that you will be awake but you won't feel any pain during the caesarean section. In certain circumstances, general anesthesia will be used, which means you will be asleep throughout the operation. There are a few common complications associated with caesarean section. Wound discomfort occurs in about 9% of patients. Increased risk of repeat caesarean section in subsequent pregnancies, which may be up to 25% of the cases. Massive bleeding occurs in 0.5% of the cases. Readmission to hospital for any reason happens in 5% of the cases. Infections occurs in 6% of the cases. Injury to baby during the operations, such as laceration or cut, occurs in 2% of the cases. Serious complications are uncommon or rare. The need for emergency hysterectomy, which means the removal of the womb, most commonly due to uncontrolled bleeding in order to save the mother's life, occurs in about 0.8% of the cases. Sometimes placental tissues retain, and one may need further surgery to remove the retained tissue. This can be done vaginally, and this occurs in about 0.5% of the cases. ICU admission after caesarean section is reported to be 0.9% of the cases. Thromboembolic disease, which means blood clots forming in the blood vessels, is rare. There are 4 to 16 cases in every 10,000 cases. However, it can be dangerous and may bring death. Injury to the bladder during the operation occurs in 0.1% of the cases. Injury to the ureter, which is the urinary tubes, during the operation occurs in 0.03% of the cases. Death is very rare. It is reported to be one case in every 12,000 cases. The more caesarean section a woman has, the higher the risk for her subsequent pregnancy. Wound care is important. As per all surgical incision wound, it should always be kept clean. If infected, the wound will not be able to heal, and in serious cases may result in severe systemic infections. It is also advisable to practice adequate contraception and to space the next pregnancy in 2 years' time. Short inter-delivery interval, which is quoted as less than 12 months for most studies, potentially increases the risk of uterine rupture.